first of all, I'm going to have you stand up, and I'm going to have you walk, just bend back. Yeah. Okay. So she has a steady gait and good posture. I'm not going to have her take clothes off. She's able to stand without falling or anything. Everything looks symmetric, and I'm going to have you just lean over and touch your toes. I'm just going to look for, there's no curvature in the spine, no lordosis, nor kyphosis, no scoliosis, no skin lesions or deformities that I can see. Doesn't look like there's anything going on with the muscles. The muscles look, they look good, tone and everything. So we're gonna look now. I'm gonna look at just your bones and your joints. So the joints, bones, they all look symmetric. Doesn't look like anything is outward or abnormal. Doesn't look like there's any going to fill now. There's no heat or swelling or crepitus, no resistance to pressure. Do you have any tenderness? Okay. So now we're going to do some range of motion exercises. So I'm going to open and or have you open and close your jaw. And then move your jaw laterally, like back and forth. And then can you protrude it, like, and then retract it, bring it back. And clench your teeth. Okay, and then I'm going to have you try and push your chin forward. Good. Push it to the side. Good. Push it to the other side. Good. So good. I'm going to feel clench your teeth. She has good muscles, good range of motion. I'm going to just turn her face that way, her whole body. So I'm going to palpate her cervical spine. Both her C7 and T1 are palpable. So her posterior neck, cervical spine, her paravertebral area, trapezius, sternocleidomastoid. So I'm just gonna move your head, so you just relax. Okay, so then I'm going to have you do that now. Chin to your chest, chin to the sky, ear to your shoulder, and the other side. Okay, and then now I'm going to have you push against my hand. Good, push against my hand. And then try not to go good, and try not to go down. Good. And then, so the thoracic and lumbar spine, I'm just going to palpate. Her spine is aligned, midline. There's no kyphosis or lordosis or scoliosis. Can I have you bend over and touch your toes again? Good. Okay, you can stand up. Cervical spine is aligned in the paravertebral area and the trapezius. And everything is symmetric along with her sternocleidomastoid joint. So now that was range of motion. So I'm going to have you move your neck side to side. Good. And I'm going to have you lean backward, extend your hips. Good. Okay. And lift your shoulders up. So she has full range of motion everywhere in her neck and in her spine and her trapezius and her sternocleidomastoid. So I'm going to fill the spinal processes. So you're going to just stand there. And the paravertebral muscles. Any tenderness or pain?
No.
Okay, and then now I'm just going to percuss the side of your spine. Like this. Any tenderness or pain?
No.
Good. And then have you touch your toes and hyperextend your at the waist. So stand up and do that again, or I'm gonna help you this time.
Oh.
Okay. So I saw you do it the first time. Have you bend? And bend, and then rotate, and rotate. Okay, and now you do the bend laterally, the side to side by yourself, and rotate. Okay, and then now I'm going to have you resist bending this way. Good, and bending this way. Good, and then rotating. Good, and rotating. Good. So she has full range of motion and strength. So I'm going to look at your shoulders. So if you'll face me again. Shoulders look symmetric. Her scapula, there's no winged scapula. And her muscles look symmetric and toned. Her humerus and biceps groove, from what I can see with her shirt on, they're symmetric and toned, and same with her muscles. So now I'm going to have you I'm going to do this first. Good. Flex your arm. Hyperextend. Good. Then good, and then internal rotation, I'm just going to do backward and external rotation. Good, and then this one. Okay, and then I'm going to have you oppose so try to lift your arms up. Good, and then try to lift up, pull them back. Good, and then try to lift them up above your head. Good, and then this, try to bring it forward, and try to bring it back, and then put it up here, try to bring it forward, try to bring it back. Good, and we're going to do this side, bring it forward, good, and up here, good. Okay, and then now I'm going to have you do those same things, so flex your arms in front of you, all the way up, as high as you can go. Good, so it's 180 degrees. Now hyperextend them backward as far as you can go. Good, about 50 degrees. Now I'm going to have you do them sideways up to your head and back down. And then I'm going to have you in front of you and back. And then the internal and external, you're up over your head, good. With it at a 90 degree. Oh. Yeah, there you go. Good. So you have full range of motion in your shoulders. And then look at your elbows. I'm going to look at them flexed and extended. Good. So the carrying angle of the elbow is probably about 10 degrees. And cubitus valgus and cubitus varus. Good, and let me see this one. Flexed, extended. Okay, so I'm going to palpate the ulnar surface and the radial surface of the elbow and the olecranon process, the medial and lateral epicondyles. Do you have any tenderness or pain upon palpation? Okay, so this side, do the same thing. Olecranon, condyles, and make sure Any tenderness or pain? So there's no swelling or thickening on palpation of her elbows. So range of motion, good. This is supination and pronation. So now I'm going to do this for you, and then I'm going to do it. Flexion, extension, supination, pronation. So then now do that yourself. Good, and then the other. So she has full range of motion in her elbows. I'm going to look at your hands and your wrists. So she has about 4 creases in her hands, her wrists. Let me see this one. Her hands look symmetric. She has 5 full fingers on each hand, and she has those 4 creases in each hand. And the thinner units and the hypo. Okay, and then I'm going to feel each of your joints. Any pain or tenderness? So her joints are all intact, no dislocations or abnormalities. And now I'm going to feel your metacarpals. No masses or lesions or anything. Is that pain at all? Okay, radiocarpal and good. No pain or anything, no masses or anything. And then I have you go like this. Put your wrist together. Is there any pain? So our general sign is negative. So I'm going to flex your fingers, hyperextend your fingers. And then can you do that yourself? Good. And then I'll have you touch all your fingers to your thumb. Okay, make a fist with both hands. Spread your fingers and try to resist. Good. Good strength. Okay, and then I'm going to have you hyperextend your wrist and flex your wrist. Good, and now I'm going to do it, so you know you're passive. Passive is good. Good. And then I'm going to do this first, so I'm going to turn your wrist inward and outward. Okay, let me see. Good. So she has full range of motion in her wrists. And then grasp my fingers in my hands. Good. Equal grasps. Okay, so now I'm going to inspect your hips. So her hips are, I'm just going to lift it up a little bit. They look symmetrical anteriorly, and I'm going to have you just turn that way. Good. They're symmetrical, no lesions or masses. Your greater trochanter, from what I can see, they are symmetrical. You can turn around and look at me again. Her iliac crest is also symmetrical, from what I can see. And then, sorry, turn around one more time. Your gluteal folds. You can't see really, but everything looks symmetrical from what I can see. I'm going to just palpate your hip and your pelvis. Any tenderness? Good. And then have you lay down on your back. Okay, so I'm going to do it first, and then you'll just do the same thing. So just okay, can you do that? So that's hip flexion. It's about 90 degrees. Okay, I'm going to do your knee to your chest. She has both active and passive. And then have you bring your leg out, across, okay, across. So she has both abduction and abduction, adduction and abduction. Can you do that same thing? Good. Of her legs. And then we turn over and do on your lay on your stomach. And then I'm going to do it first. Hyperextension. Good. Good. Now you do it. Good. Good. So she has full range of motion of her hips. So I'm going to have you turn back over again. And we're just going to do internal and external rotation of the hips. So external rotation, internal rotation, external rotation. Good. And can you do that yourself? Good. Okay. So now if you could sit on the side of the couch, sorry, get a look at your knees, and then can you extend your, good, so her knees are symmetric, both flexed and extended. You can sit down, and then you can stand up so I can just look at your popliteal space. So her popliteal spaces are symmetric and equal, they're not swollen or anything. You sit down. Medial and lateral tibial condyles are symmetrical, and medial epicondyles and lateral epicondyles of the femur, they are both symmetrical as well. And then patellas, symmetrical, and there are no knock knees, bow legs, or hyperextensions of the knees. So now I'm going to fill and have you stand up again. Sorry. I'm going to fill so the popliteal space is soft. There's no swelling or inflammation. Tibial femoral. Okay. There's no blotting of the knee, the patella. There's the tibial femoral joint. Feels good. Can you lay down? The suprapatellar pouch is present, and the infrapatellar fat pads are present. There's no blottment or bulge sign. Okay, and then I'm going to have you sit on your knee. I'm going to sit on the chair, sit on the edge, and then you're going to flex your knee back and then extend it. And the other one as well. Okay, now I'm going to do that. Okay, so she has full range of motion in her knees. Now I'm just going to inspect your feet, your ankles. Okay. Medial and lateral malleoluses are symmetrical. They look intact. No masses or abnormalities. Same with her Achilles tendons. Can I have you stand up? They look the same as when she's sitting. Okay. Can I have you sit down? She has 5 toes on each foot, full toes. She doesn't have any in-toeing or out-toeing or flat, but she has good arches, both standing and sitting. She doesn't have a high instep. Her arches look, they are arched, they aren't flat, they aren't too high. And then she doesn't have any hammer toes, claw toes, or hallus valgus. I'm going to fill. There's no bursas, bunions, redness, swelling. Is there any tenderness or pain? Okay. So now we're just going to do, there's no corn anywhere. So I'm going to palpate her Achilles tendon. They're intact and strong. Anterior surface of her ankle ankles, there's no swelling, pain, or tenderness. And then her joints. Good. Good. So there's no abnormalities or masses or anything. So I'm going to have you, I'm going to do dorsiflex, plantar flexion, inversion, eversion, and then adduction and abduction, and flex and extend. So can you do that dorsiflex and then point your toe, and then can you roll your foot outward? Good. And the other way with your whole foot, and then go to side. Good. Okay, so now we do the same dorsiflex, plantar. That's eversion and inversion, adduction and abduction, and flex and hyperextend, or extend. And then your toes, flex. Good job. Okay, so now I have you lay down. I'm going to measure your arm and your leg. $27.5. And 27.5, there's 2. And I'm going to do your legs. Okay. To your heel. About 35. The left leg. And this is about 35. The same 35 on both legs. And that's all for the musculoskeletal.